thoughtfully combines classical homeopathic principles with evidence based integrative care. She beautifully bridges traditional homeopathic philosophy with modern immunological understanding, focusing not merely on symptoms suppression but on restoring immune balance, enhancing resilience, and promoting long term well being. She has actively contributed to patient centered care models that integrate lifestyle medicine, stress modulation, and constitutional homeopathy alongside conventional immunological management. Today, she will guide us through the fascinating concept of the immune paradox, helping us understand why the immune system sometimes turns against the body, why autoimmune diseases are rising globally, and how an integrative approach can provide meaningful support in managing these complex conditions. Please join me to warmly welcome Dr. Vinita Goyal.
Thank you, Nivedita. A very good day to everyone. It's a great honor to speak today amongst my respected teachers, seniors, and colleagues. So, just a second. So, before we begin with slides, statistics, or science, I want you to picture a patient you saw this week. Maybe a 28-year-old with rheumatoid arthritis, maybe a 35-year-old with Hashimoto's, maybe a teenager already ANA positive. Ask yourself, how did we reach a point where the immune system designed to protect life is attacking it? Once upon a time, the immune system had one clear job: to protect. It knew how to differentiate self from non-self. It attacked invaders, repaired damage, and returned to balance. But somewhere along the way, that balance shifted. Over the next hour, we'll journey through the science of autoimmunity, examine how homeopathy interprets and address these conditions, and discuss how integrative approaches can bring new hope to the patients. So the overall burden. The burden is increasing, it's rising. Autoimmune disorders now affect approximately 5 to 10% of the global population. In some regions, nearly 1 in 10 individuals carry a diagnosed autoimmune condition. A large study by Metropolis Healthcare, it has found that there is a 30% increase in autoimmune disorders among the Indian population since COVID-19. After the pandemic, this increase has been seen. The prevalence of anti-nuclear antibody, ANA positivity, a key diagnostic marker, has risen significantly between 2019 and 2022. Rheumatology report, this is a report by Fortis Healthcare, it indicates that musculoskeletal autoimmune disorders may affect a significant portion of adults. And the rise is disproportionately seen in younger individuals. So the question becomes why? Diseases once labeled rare are now common and increasingly early. This is not a coincidence. This is not merely better diagnostics. This is a biological alarm bell. If we see which are the key conditions which are on rise in India, it's thyroid disorder, Hashimoto's, Graves' both, rheumatoid arthritis, SLE, psoriasis, vitiligo, celiac diseases. If we talk about why autoimmunity is rising, let us examine this clinically. First is genetic predisposition. So we can say genes load the gun and the environment, it pulls the trigger. Modern diet, it's like feeding the fire. Highly processed foods, excess sugar, low fiber, artificial additives. So nearly 70% of immune training, it occurs in the gut-associated lymphoid tissues. When the microbiome is disrupted, immune tolerance weakens. The hygiene hypothesis. Cleaner environments, less microbial exposure. Our immune system was designed to learn through exposure. It now grows up undereducated. Pollution and environmental toxins, heavy metals, pesticides, air pollutants, these all act as chronic immune irritants. This leads to persistent low-grade inflammation. What does this inflammation do? We'll be seeing in further slides. Chronic stress. Stress is not only psychological, it is immunological. Chronic cortisol dysregulation alters cytokine balance and T cell functions. Last but not the least, viral triggers. Through molecular mimicry, pathogens resemble host tissue. The immune system attacks the virus and sometimes it continues attacking self. We see this pattern in conditions like all the autoimmune disorders like rheumatoid arthritis, lupus, Hashimoto's thyroiditis, psoriasis, multiple sclerosis. So different names, different organs, but the same underlying theme, that is self-directed immunity. Now we arrive at the heart of today's discussion, immune paradox. What is this immune paradox? Immune paradox refers to the strange duality in autoimmune diseases. The immune system is simultaneously hyperactive, means it's over responding and attacking self tissues, and dysregulated. So dysregulated means it's failing to maintain balance and tolerance. This paradox explains why patients experience both destructive inflammation and impaired defense against real threats. Breaking it further down, hyperactivity's immune system is on overdrive. It becomes over responsive, producing excessive antibodies or T cell activity. This leads to chronic inflammation, tissue damage, and symptoms such as joint pains, rashes, organ dysfunctions. So as we see, for example, in rheumatoid arthritis, the hyperactive immune cells attack synovial tissue, causing swelling and erosion. For dysregulation, the immune system loses its ability to distinguish self from non-self. The regulatory T cells and cytokine balance, it collapses. This allows self-reactive cells to persist. Dysregulation also means the immune system may be ineffective against infections, leaving patients vulnerable. As an example, in SLE, systemic lupus erythematosus, dysregulated immune tolerance allows autoantibodies to attack DNA and proteins. Now, why it is a paradox? Normally, hyperactivity should mean stronger defense, but in autoimmunity, this strength is misdirected. The immune system is too strong in wrong direction, that is attacking self, and it's too weak in the right direction, that is failing to protect against pathogens. तो जो काम करना चाहिए वो कर नहीं रहा, जो नहीं करना चाहिए वो कर रहा है. So this duality explains why autoimmune patients often suffers both flare-up of inflammation and higher infection risk. Understanding this paradox, it helps us to understand it is not simply suppression versus stimulation. In fact, it's regulation. What's the mechanism behind this paradox? So there are multiple factors. Cytokine imbalance. Access pro-inflammatory cytokines like TNF, IL-6, they drive hyperactivity, while regulatory cytokines, they fail to suppress misdirected responses. Defective T regulatory cells. Normally, they prevent autoimmunity, but their dysfunction leads to loss of tolerance. Molecular mimicry. Pathogens resemble self-proteins, tricking the immune system into attacking both. Genetic predisposition. Certain HLA types increase risk of both hyperactivity and dysregulation. So with all this, we come to the next topic, that is gut immune axis. We now know that the gut microbiome plays a critical role in regulating immunity. A disrupted gut environment can trigger immune misfires. Recent reviews evidence that gut microbial imbalance is linked to onset and progression of various autoimmune diseases. To understand, let's think of our gut as a busy city, which is full of tiny residents like bacteria, fungi, and other microbes. So now when the city is balanced, good citizens keep the peace, they produce helpful nutrients and train the immune system to stay calm. So beneficial microbes regulate inflammation. They produce short chain fatty acids and they train regulatory T cells. But if the city falls into chaos, there are too many troublemakers, which are bad bacteria, not enough helpers, and the immune system gets confused. This leads to increased in barrier permeability, the antigen exposure rises, immune confusion begins. So everyday things like diet, stress, antibiotics and pollution can disrupt this balance, just like poor governance can destabilize a city. The gut microbiome actually acts like the immune system's teacher. When it's healthy, the immune system learns tolerance, but when it is disturbed, the immune system misfires. So what is the inflammation and cytokine storm? Inflammation is protective until it becomes chronic. Cytokines are chemical messengers. In balance, they coordinate healing. In excess, they create a storm. Persistent cytokine elevation leads to tissue destruction, fibrosis, organ dysfunctions, and so on. So the triggers such as infections, toxins, stress, poor diet, or environmental exposure, these act as sparks. These spark ignites inflammation. Inflammation is protective for us, but here it becomes chronic and gets misdirected. If unchecked, inflammation escalates into a cytokine storm. This overwhelms the body and causes various diseases. So imagine a time when diseases were mysteries, their roots unseen and misunderstood. Dr. Hahnemann, the father of homeopathy, embarked on a journey to uncover the hidden forces behind chronic illnesses. He called these forces miasm, deep, invisible disturbances that quietly shape our health. In his seminal work, The Chronic Diseases, 1828, Hahnemann introduced three main miasms: psora, psychosis, and syphilis. Though Hahnemann never spoke of autoimmunity as we know it today, but his description of the vital force being deranged by these miasmatic influences, it mirrors modern science's understanding of immune dysregulation. It is as if body's own defense system, meant to protect, becomes confused and turns against itself. Fast forward to today, the science reveals that autoimmunity stems from a complex interplay of genetic predisposition, environmental triggers, and imbalances within our microbiome. So these modern insights echo with Hahnemann's miasm, unseen forces shaping health from within. Over 2 centuries ago, Dr. Hahnemann did not use immunological language, but he described altered reactivity, he described chronic internal predisposition and layered pathology. In autoimmune expression, we often observe mixed miasmatic states. We see psoric sensitivity as in inflammations. We see psychotic overgrowths as in thickening nodules. Syphilitic destruction is seen in erosions and degenerations. Take example of rheumatoid arthritis. There is inflammation, then there is synovial proliferation, then there is joint destruction. This layered progression mirrors miasmatic evolution. So, we are not treating a joint, we are treating a dynamic internal disturbance. If we try to understand autoimmunity from the homeopathic lens, let us begin with basics. Autoimmune disease means the immune system is attacking self tissue. But from a homeopathy perspective, what does that imply? That implies loss of discrimination, altered reactivity, dysregulated defense, and internal confusion. In organon terms, this is disturbance of the vital force manifested at tissue level. Now, there is an academic question. Why does the immune system begin to misidentify self as non-self? Here the conventional medicine explains the mechanism as molecular mimicry, T-cell dysregulation, cytokine storms, all valid. But mechanisms are not causes. Mechanisms explain how. We must ask why this person. And this brings us to susceptibility. Where does this integrative care fit? Let us be balanced and clear. In today's autoimmune landscape, biologics and immunomodulators, they have transformed outcomes. They target cytokines, block pathways, and reduce inflammation with precision. Yet, they often leave patients yearning for deeper healing. Patient wants relief from fatigue, relief from emotional distress, and a sense of being well. So we can say biologics contain the storm and homeopathy restores resilience. Patients today are informed, curious, and often overwhelmed. They want both the security of scientific evidence and the authenticity of lived experience. Clinical markers reassure them that the treatment is working. Subtle shifts to better sleep, calmer mind, renewed energy, this often comes from homeopathy support. By respecting both, we create care that is not reductionist but human-centered. We speak the language of science while honoring the narrative of healing. Together they create a dual path working towards the cure. In acute severe SLE, conventional care is life-saving. But where does homeopathy fit? It fits in modulation. It fits in reducing relapse frequency, in stabilizing emotional triggers, in improving adaptive capacity, in reducing intensity of flares, and in improving vitality. So this brings us to the question how to approach such cases. Case taking becomes central in chronic autoimmune management. We need to identify first trigger, identify dominant emotional state, study thermal state, study modalities carefully, identify miasmatic background, and most important, avoid prescribing only on pathology. The most common mistake, prescribing only on organ diagnosis. Remember, RA is not a remedy. Psoriasis is not a remedy. Hashimoto's is not a remedy. Person is the prescription. So in autoimmune cases, depth of case taking determines depth of result. So we have inflammation is the body's fire alarm. In autoimmunity, the alarm never stops ringing. Holistic approach teaches us how to quiet the alarm through lifestyle, stress management, and diet. So healing can begin. Lifestyle, regular physical activity, adequate sleep, exposure to nature, these all help regulate immune balance and reduce chronic inflammations. Lifestyle begins to matter deeply. Movement tells immune system how to behave. Sleep resets the inflammatory circuits. Nature exposure reminds the immune system what balance feels like. Stress. Chronic stress elevates cortisol and inflammatory cytokines. Mind-body practices, they calm the nervous system and restore immune regulation. Stress, when calmed through breathing, meditation, or yoga, directly reshapes cytokine signaling. Diet. Anti-inflammatory foods such as omega-3, turmeric, leafy greens, they support immune resilience. Processed food, sugar, excess red meat, it can fuel inflammation and dysbiosis in the gut. Diet, when anti-inflammatory and fiber-rich, it restores microbial governance in the gut. Healing becomes possible not by silencing immunity but by teaching it again. Gut health. A balanced microbiome acts like a peacekeeper, teaching the immune system tolerance. Probiotics, fiber-rich foods, fermented foods, they all nurture this balance. So bringing it all together, let us connect everything that we have discussed. Autoimmunity rises because environment has changed, the diet has changed, the stress has changed, microbial exposure has changed. Immune system adapted to all these changes, but sometimes it maladapted. It becomes hyperactive and dysregulated. This leads to persistent inflammations. Now the susceptibility determined our expressions. Modern medicine controlled the storm. Integrative approach aims to restore steering. And as clinicians, our responsibility is to defend the patient's health. We need to expand our understanding. We need to observe deeply and treat beyond labels. To restore balance wherever possible is our motto. Because the immune system is not our enemy, it's a powerful intelligence that needs direction, not destruction. I would like to follow this with a case. I like to share a case with you. This is a case of ITP, chronic immune thrombocytopenic purpura. So in June 2023, I met a 45-year-old man, and he had this condition where the immune system mistakenly started destroying his platelet count. His journey began 5 years earlier to it. In 2018, he had a severe episode of dengue. During dengue, his platelet count had crashed to 9,000. He required 2 transfusions, but somehow he survived the infection. But in all this, his immune system did not return to normal. Over the next few years, what happened, his platelet counts started showing a persistent downward trend, and eventually he was diagnosed with a chronic ITP. His counts would frequently now drop to 20,000. He was started on steroids. Later, he was placed on romiplostim injection. This is a thrombopoietin receptor agonist designed to stimulate platelet production. The injection worked temporarily. His platelets would rise to around 70,000, but to fall again. He required these injections twice a month. So it was a cycle of rise and fall. In 2023, he had been advised to consider splenectomy because his body was not showing any much change. So when he came to homeopathy, his problem was not just low platelets. He had constant fatigue, easy bruising, slow wound healing. He had pains, back pain, joint pain. He described feeling chilly whenever his platelets dropped, almost as if he could sense it before the reports confirmed the count. In addition to this, he had developed chronic constipation with hard stools, eventually leading to fissure in ano. He had severe pain and bleeding after every bowel movement. He had strong craving for fats, butter, ghee, savory foods, aversion to sweets, strong body odor in perspiration, especially torso and groin, strong smelling urine, irritating sticky saliva. He said, whenever I talk over phone, there are some rigid white spots left on the screen of the phone. But beyond the physical symptoms, there was a deeper story. During COVID in 2021, he lost both parents. He also lost a stable job. Financial insecurities followed. He took another job but was unhappy and constantly stressed. He had become irritable, defensive, suspicious, averse to risk. He could not trust easily anyone. In fact, after starting treatment, he posted a negative review within 4 days saying it was ineffective. 2 weeks later, he returned admitting that he felt better. That moment, it told me something important. His immune system was behaving the same way he was. It was defensive, it was hyper alert, reacting strongly, and unwilling to let go. This was not merely a platelet production issue. Romiplastim was stimulating the bone marrow, but the immune destruction process continued in the background. The fire was being managed, but the tendency remained. After detailed case taking, a constitutional prescription was given, and this was given based on his full physical and psychological picture. So we began his treatment on 16th June 2023, and he took his last romiplastim injection on 28th June 2023. So there was no abrupt decision. Monitoring was careful and regular. Over the next few months, something actually changed gradually. So his platelet counts stabilized without further injections, bruising reduced, his energy levels improved, constipation got resolved, irritability softened, family relations improved. Most importantly, no splenectomy was required now. So homeopathy treatment was then again tapered in March 2024 and stopped. So the table here shows his platelet count records till 27/4/2023. As we can see, these are the lab values. Above this, these are the lab values before he started with homeopathy. 6 July 2023 to 9th March 2024 was when he was under a homeopathy treatment. This table on right hand side shows his platelet counts post treatment. Since then he continues to share follow-up reports. His platelets remain stable. During occasional viral infections, there is a mild dip for about a week, but recovery happens spontaneously without any intervention. So this case does not suggest abandoning conventional care. Severe thrombocytopenia is life-threatening and requires proper hematological management. But what this case illustrates is something deeper. Autoimmunity is not about numbers. It is about an immune system stuck in defensive overdrive. When that defensiveness is regulated physically and constitutionally, resilience improves. And sometimes when the immune system remembers how to balance itself, the need for constant stimulation reduces. That was the story of this patient. Let me share another story, very different in age but similar in immune struggle. In 2018, a 68-year-old woman began experiencing frequent nosebleeds and was diagnosed with ITP. Over time, her condition became severe, platelet counts often falling to 3,000 to 5,000. She required again romiplastim injection 500 mcg every 10 days, along with cyclosporin, immunosuppressant, and Revolade, which is again an oral thrombopoietin receptor agonist. And she got a splenectomy done in 2022. But even after splenectomy, there was no lasting improvement. The condition persisted. She suffered from dark continuous bleeding from nose, gums, rectum. There were petechiae across her body, numbness, pricking in her limbs, extreme weakness, and inability to move during low count episodes. Despite being a hard-working village woman, her vitality had faded. She was hot by nature, craved cold air and water, and had a frequent appetite. Yet she was anemic with shriveled skin and sunken eyes. Homeopathy treatment began in May 2024 alongside her ongoing allopathic care. Initially, changes were subtle, but gradually the pattern shifted. The gap between Romi injections extended from 10 days to 15 days. In the table here we can see in July, on July 23rd, 2024, the platelet count rose to 44,000, which was higher than seen in years. Though it fell again. Within 4 days, it fell again to 3,000. In August again, it rose to 68,000 and sustained a little longer than the last time. By December, there was a remarkable spike to 3 lakhs. And the injection interval was risen to 25 to 30 days. She didn't need any injection for these many days. Obviously, the pattern had changed. Not permanent remission, but improved resilience. Not elimination of disease, but altered response dynamics. Meanwhile, her general condition improved noticeably. There was better mobility, improved digestion, increased strength, better overall vitality. Based on her symptoms, which were, she had a strong appetite, she was a hot patient asking for cold and fresh air. Though physically she felt cold to touch because of anemia, her bleeding was characteristic, dark, thin, oozing. So there is a rubric in Boric which says, blood-like ink exudes on tongue. See, you can see here in this picture, this is what her tongue looked like. So, based on all these symptoms, I gave her, constitutionally, I gave her Sikale Cor. Sikale Cor 30 was given, and acute bleeding episodes were supported with Arnica and Hemamylase Q. And the rheumatologist who referred this case to me had told me that we have exhausted our options. See if your system can offer anything. So I can proudly say yes, my system had started working on the female, though there were many negative aspects, the age, splenectomy. So, but yes, the system had started showing results on the lady. Unfortunately, expectations for permanently stable high counts, it led the family to discontinue follow-up in early 2025. So was this a complete cure? No. Was it a change in disease pattern in a refractory post-splenectomy ITP case? Yes, definitely it was. Sometimes success in chronic autoimmunity is not a straight line upward. It is a change in frequency, intensity, and resilience. This case reminds us that in severe immune dysregulation, regulation may begin as altered patterns, not instant normalization. This brings us to the takeaways. I would say today's takeaway were autoimmunity is not immune weakness but immune misdirection. Hyperactivity combined with loss of regulation, gut health, stress, lifestyle, and post-viral triggers are key immunological drivers shaping disease expressions and relapse. Effective care requires strategic integration, controlling inflammation while restoring long-term immune regulation and resilience. This brings us to an end of today's discussion. Thank you all for giving me your time and attention today. Even in cases labeled refractory or nothing more can be done cases, there may be still room for change. Integrative thinking is about expanding our clinical lens. I hope today's discussion inspires you to keep questioning, observing, exploring possibilities that may offer our patients a better quality of life. Thank you.
Very nice, well present, very well made presentation. I would say, and it was
Thank
very.
you.
I mean, the cases were well explained. I would request our President Dr. Mukesh sir to please say something.
If there are any questions,
So chat में तो नहीं है, but
okay.
yes, anyone can post. Yes,
If there is no, then I'll summarize.
yes, sir.
Okay, one thing I'll say, Dr. Vinita
Yes, sir.
Koyal, it was an excellent presentation, and it is unfortunate for people who have not attended.
Thank you, sir. That
Hi.
means a lot because this was my
Because
first presentation.
in spite of low attendance, I'm very sorry for people who have not attended. It was very good presentation, scientific, evidence based, and
Yes, yes.
I think very honest and very transparent. You have shown all lab parameters. You have accepted that this patient left, and the first one improved. Yes, this question I have also wanted to ask. What was the
This,
remedy in
yeah.
first case?
So
Yeah.
it was acid nitricum. I think I missed
I
mentioning.
got it was nitric
It was
acid.
acid nitricum 30. So no higher potency was given. Acid nitricum 30 has given
So
the
I
result.
had idea it is nitric acid. Now, one question I want to ask in both the cases, whether in second case especially, whether you have given on the basis of the boric symptom from boric, or whole case was repertorized.
Sir, a whole case was repertorized, but means this was one symptom I have never used before, and I couldn't actually properly understand this symptom also before I got onto this case.
Okay.
So then seeing the picture and reading the symptom, then I could see yes, this is what Dr. Borik was talking about.
That's good. That's good. And another question is, are you using any software for repertorization?
So I'm using radar.
Radar. Okay, that's good. And one question, when you referred the second case, no, or the first case, which was referred to you, or second case was referred?
Sir, there have been many cases now of autoimmune cases where
No, no,
diseases.
we are talking about two cases you
The
have
second
discussed.
case was referred. First case, it came on his own.
Okay, so the patient went back to the doctor who has referred.
Sir, the patient was always under her treatment. Along with allopathy, she was taking homeopathy.
Okay, so what was the response of that doctor when she improved? To
Sir,
what extent?
again, he was like, see, if homeopathy can do, we have done already done whatever we could do.
No, it's
And
okay.
this is,
That is at the time of reference. But
Haji
when
sir.
the patient had marginal improvement, what was her response?
Sir, I can say कि, response in the terms that he sent many more patients to me.
That's good,
So,
no? That is what I wanted to know. That is what
yes,
I
sir.
want to know. And secondly, I want to say another thing. You should work more on this miasm, and because it is your interest of autoimmune disease to correlate various miasms with the this autoimmune disease which you are working on. And more is that gut health you have emphasized. I think it is a hot topic. A lot of things are being discussed these days about it. And so let us work on that also, and see what are the results with homeopathy. One question I have, that you can you repeat why the things are changing with the modern time? Initially, you said the result was this because of auto. Now you have listed some factors.
Mm-hmm.
I think in that there was one thing you mentioned, that microbes are behaving differently. I think this was you said.
Like I have already mentioned, this hygiene hypothesis is there. Various viruses are triggering it. It's being in the research. It's showing that post COVID-19, post that
Okay,
infection, things have changed. Now it's a
okay,
debatable topic. COVID-19 was actually behind it, or the vaccines have done something to the reaction, human reaction.
okay. And one thing, another thing, I appreciate you admitted that you gave, along with cecal core in between, you gave arnica and hamamelis. You admitted, because people say, I have given one dose or I have given cecal core only. Because actually, these diseases require a chain of medicines. It is not very simple as we see or we
Yes.
read in theory that one single dose is given and the case is cured. Now we require a chain of partially indicated medicine, especially when there is pathology. And you have admitted that, because many people say, I've given one dose and then the case was cured. You admitted that you gave arnica and hamamelis mother tincture. That is very honest on your part, and the transparency is there. It was wonderful, excellent, and I would suggest, if possible, on 5th or 3rd, whatever Hanuman Day we are having, if possible, can you make this presentation again in the,
Sure, sir. Anytime, as you say, sir.
yeah.
Anytime.
So I would suggest if we can present, because CGHS people will be doing their part, but from our side, if you can do it, that will be good, along with one or two more speakers.
Sure, sir. That will be an honor.
Thank you, Anita. It was wonderful, excellent, and keep on doing good work. We need you, and we'll frequently bother you to make more presentations.
Sir,
But
anytime.
kindly focus on that mechanism and relation of autoimmune diseases and gut health. That will be very interesting to see. Thank you.
Thank you, sir.
So over to Mrinalini.
Yes, sir. Sir, we must congratulate that it is Vinita's first presentation.
Yeah, it was
Uh,
wonderful.
yes, and, from IHP Delhi State Branch, we
Yeah,
actually thank you so much. Thank you so much, Dr. Vinita, and thank you all the doctors for your patience and attendance.
and
Thank you so much. And Dr. Geeta, please.
डॉक्टर विनीता कॉन्ग्रेचुलेशन डॉक्टर मिनार ने आपने बनाया ना इनको आईएचपी में बुलाया था लाइव मेंबर
Yes,
Yes,
ma'am.
ma'am.
साथ में अब मुझे पता है
so thank you,
ना
Mrinalini.
यस
You, you have given
और
us a
अभी
wonderful
हाँ
member.
नेक्स्ट
Huh?
नेक्स्ट